Next up, one of my favorite things to show at the Hint Summit, for those of you familiar with this, part of our infrastructure is kind of allowing networks to manage their relationships, their affiliations with other clinics. And so we've now grown that network to over 700 affiliations. And so what this is showing is this a visualization of the Hint ecosystem all the way from 2014. A dark blue dot will be an account, a light blue dot will be multiple locations surrounding that account, a red dot is an employer, and you see the connections that are forming. That's the sort of emergent properties of a network when all of these different networks that are using our infrastructure to power all of these interconnected relationships across the Hint ecosystem. So I just really kind of like sharing this visualization because I really think it shows the power of the DPC community and how instead of this sort of top-down hierarchical big system thinking, it's more decentralized sort of bottom-up relationships that are forming across the ecosystem. And Hint is doing nothing else other than powering the connectivity between relationships that doctors and clinicians and different provider groups are forming between themselves. So this is, again, zooming back out through time, so you can kind of see that evolution go back. Anyway, pretty cool, right? So that's kind of a big one. The other thing that we've been working on at Hint is is Hint Connect. So since our last summit, we've grown the Hint Connect network to 350 locations, about 37 active states. You see a bit of a map here. I'm going to introduce and welcome on stage Dr. Cameron, who's our Chief Medical Officer of Hint Connect, and Beth Holmes, who is the head of Hint Connect. So please welcome to the stage. Welcome. Why don't you sit over there and I can face you guys? Yeah. I guess, Dr. Cameron, I'd love just to start out. I'm sure many of you are familiar with Hint Connect, but can you just provide a kind of an overview of Hint Connect and what it is and what it means to you?
Right. Hint Connect.
Mike.
Hello.
Is it on?
Project.
No. Let's get it fixed. Yeah. On. There we go.
Great.
I'm tech support sometimes.
Sometimes doctors can work tech. So Hint Connect is a collection of direct primary care doctors, a network across the country so that we can partner with larger employers that are in numerous geographies so that we can be able to have conversations and say, you have employees across numerous states, and so we can partner together so that we can be able to address those geographies. And also to make it much easier for them to be able to do that contracting. They don't want to contract with 50 different DPCs. It's just too difficult. Plus, they would like to have some semblance of standardization in terms of primary care, urgent care that's delivered, chronic disease management, same day, next day access, keeping our cell phones on 24/7. And so our whole goal is to be able to drive direct primary care to be accessible to many more people. And especially when I'm in a practice with 4 doctors, we can't take care of a number of employers because we don't have the geography. But if we work together, we can be able to help bring DPC to so many more people in the United States. So that's the vision. And if some of you are thinking about direct primary care, about Hint Connect, please come talk to me, talk to Beth, talk to G. We'd love to have you join our community.
Great. And so, Beth, why don't you just give us a quick overview of kind of how the Hint Connect ecosystem has evolved over the last 12 months?
Yeah, so we've made some really exciting advancements working with network partners who are already in their markets doing good work, already have the relationships. So we are not disrupting that. We're working in partnerships with networks that are already out there, which has really helped us grow quickly. And then G has been really pounding the pavement, working with smaller practices who want to go through employers. So as you introed, we're 37 states, hope to be in 50 next year, and just going to keep growing.
Great. So I wanted just to spend a few minutes kind of highlighting, I think one of the things I've been excited about with Hint Connect over the last 12 months or so is just seeing some of the kind of partnerships that are emerging and kind of, again, sort of a bottom-up emergence. And so I'll just maybe walk through, there's 3 kind of categories that I think is really interesting and compelling. If we get some slides here. The first, I'd like to have sort of Dr. Cameron kind of talk through Why don't you just kind of talk through a couple of examples of DPCs that we're working with and kind of what's going on there?
So one scenario is when a direct primary care identifies an employer that they want to work with, but they don't have the geography to take care of all of those employees. And so for instance, Primary Health Partners has been doing this. They've got many employers, and they're identifying employers that have a larger geography that they have been able to take care with all of their current affiliates. And so they have leveraged the Hint Connect network to be able to take care of the rest of those geographies. And so it's just another way. So if you as a DPC are finding that you've got employers that are interested in direct primary care, but they're in numerous locations, you can partner with Hint Connect, you can own that contract, and then ask Hint Connect to be able to assist in some of those other geographies.
And so the idea is that you could, in your Hint account, if you have an employer deal, assign some of those patients to the providers that you can't serve, to one of the Hint Connect providers, and we'll flow that all the way through our infrastructure straight into that clinician's Hint account, and they'll get paid. So it's pretty cool. So why don't we just jump in? What's another, this advisor's component here, Beth?
Yeah, so kind of like Ben Aiken and David were saying this morning, when you're whether you're a DPC working with advisors directly in your community or you're large and you're working with advisors on a bigger scale, having aligned partners is the most important thing that you can do to make sure that you're going to be getting in and positioned well in plans with employers. So we're working with organizations like ePowered Benefits, Alera Group, to bring DPC into plans and into offerings for employers at a large scale.
Cool. And then the last one is what I consider as integrators. So obviously you've all heard of Decent, and there's another new partner of ours, Clearwater. And what these groups are doing is they're essentially integrating. They're a healthcare, a health plan, or in the case of Clearwater, a health sharing group. And what they're actually doing is integrating through the APIs DPC directly into their plan. So the idea is if you enroll with one of these plans and you choose the DPC option, it'll automatically enroll that patient into the DPC clinician of choice of that patient. So this idea is it allows us to bring DPC to these various different innovative groups that really truly understand and authentically want to connect and partner with DPCs. We're trying to make it easy for them to do that at scale. So I know we're running up against the bar here, so I think...
yeah, let's go let people do.
Yeah, let's go have it. And so that's really... So thanks so much, Hint Connect team, appreciate it. Yeah, cool. All right, so that's it. Thank you for bearing with me. I know there was a lot we just went through, but this is one of my favorite times of the year, and I really appreciate you all showing up, and I just love the energy in the room. I love the collaboration. I love just the mission of what this community is all about. So thank you so much.
She know what she need, all she blessed.